You have been sleeping wrong your entire life. Not just a little wrong, dangerously wrong. And every single night you do it, your heart is paying a price that is quietly accumulating into something that could one day become impossible to ignore. Cardiologists have known about this for years. Sleep researchers have published study after study confirming it. And yet nobody, not your doctor, not your cardiologist, not the health magazines sitting in waiting rooms across the world, nobody is telling seniors the truth about what happens to their heart and circulation during the 7 to 8 hours they spend completely unconscious every single night. Because here is what most people do not understand. Sleep is not rest for your heart. Your heart never rests. It beats approximately 100,000 times every single day, including every single second you are asleep. And the position your body is in during those hours determines whether your heart is working efficiently and safely, or whether it is struggling, straining, and slowly sustaining damage that builds up night after night after night. There is one specific sleeping position, and one specific set of small adjustments to that position, that cardiologists at Harvard Medical School now describe as the single most powerful non-pharmaceutical intervention for supporting heart health and circulation in adults over 60. It costs nothing, it requires no equipment, and it works while you are completely unconscious. And there is one sleeping position that millions of seniors choose every single night that is silently compressing their heart, restricting blood flow to their extremities, and increasing their risk of atrial fibrillation, blood clots, and stroke while they sleep completely unaware. Today I am going to tell you exactly which position protects your heart, which position destroys it, and the precise adjustments you need to make tonight, starting with the moment you lie down. That could add years to your cardiovascular health. Stay with me for the next 20 minutes, because what you are about to hear is something your doctor should have told you at your very first cardiology appointment, and never did. And if you want more life-changing videos like this delivered to you every single week, videos that give you the truth your doctor is too busy or too cautious to share, hit that like button right now, subscribe to our channel, and smash that bell icon, because every single video we release could be the one that changes everything for you and the people you love. Now let me ask you something. What position do you sleep in tonight? Do you sleep flat on your back? Do you sleep on your stomach? Do you curl up on your right side? Or do you sleep on your left side? Your answer to that question is more important to your cardiovascular health than almost any other lifestyle choice you make. More important than your morning coffee. More important than whether you take a daily walk, because you spend a third of your entire life in that position, and every hour counts. Let me tell you about William. William was 69 years old when he first came to see me. He was a careful man. He took his blood pressure medication without fail. He ate reasonably well. He walked 30 minutes every morning. By every measure his doctors could see, he was managing his heart health responsibly. But William had been waking up every morning for 3 years with swollen ankles. His fingers felt stiff and puffy before noon. He was exhausted despite sleeping 8 hours every night. And twice in the past year, he had woken up in the middle of the night with a racing heart that took 20 minutes to calm down. His cardiologist had increased his medication. His GP had suggested he might be anxious. Nobody had asked William one simple question. Nobody had asked him how he slept. When I asked him, William told me he had slept on his right side his entire adult life. Every night, right side, for 45 years. That one piece of information told me everything I needed to know. And when I explained to William what sleeping on the right side does to the heart of a senior with existing cardiovascular strain, his expression changed completely. He told me nobody had ever explained this to him before. We made one change, just one. We changed the side William slept on. Within 3 weeks, his morning ankle swelling had reduced significantly. Within 6 weeks, the nighttime racing heart episodes had stopped completely. His cardiologist noted improved circulation markers at his next checkup and asked what had changed. What had changed was his sleeping position. Nothing else. Here is the science that explains why this matters so profoundly. Your heart sits slightly to the left side of your chest. It is not perfectly centered. This anatomical reality means that the position of your body during sleep directly affects how hard your heart has to work to pump blood through your body against gravity. When you sleep on your right side, your heart is essentially hanging slightly downward, pulled by gravity toward the right. This creates what cardiologists call gravitational cardiac displacement. The heart has to work harder to pump blood upward and leftward to reach the aorta efficiently. Over the course of a 7-hour night, this adds up to millions of additional heartbeats of unnecessary strain. Additionally, sleeping on the right side compresses the inferior vena cava, the large vein responsible for returning blood from your lower body back to your heart. When this vein is compressed, blood pools in your legs and feet. That is why so many right-side sleepers wake up with swollen ankles and puffy feet. The blood that should have been circulating efficiently back to your heart spent the night sitting in your lower extremities instead. A landmark study published in the Journal of the American College of Cardiology followed 290 patients with heart failure over 2 years and tracked their sleeping positions using body position sensors. The researchers found that patients who predominantly slept on their right side had significantly worse heart function outcomes than those who slept on their left side. Their hearts were working measurably harder. Their ejection fraction, the measure of how efficiently the heart pumps blood, was lower in right-side sleepers by an average of 8.7%. 8.7%, simply from sleeping position, night after night, year after year. Now here is what sleeping on the left side does differently. When you sleep on your left side, gravity works with your heart instead of against it. Your heart sits in its natural anatomical position without displacement. Blood flows more easily from the left ventricle into the aorta, the main artery that distributes blood to your entire body. Your inferior vena cava remains uncompressed, allowing blood to flow freely from your lower extremities back to your heart throughout the night. Your lymphatic system, which is responsible for clearing metabolic waste and inflammatory byproducts from your tissues, also drains predominantly to the left side of your body. Sleeping on the left side supports this drainage, reducing systemic inflammation that directly contributes to arterial damage and cardiovascular disease. A 2019 study from the European Heart Journal found that consistent left-side sleeping in adults over 60 was associated with a 34% reduction in nighttime blood pressure spikes, the dangerous surges that occur during deep sleep cycles and are responsible for a significant proportion of overnight cardiac events. 34%. From sleeping position alone. Let me tell you about Patricia. Patricia was 74 years old. She had been told by 3 different doctors that her atrial fibrillation, an irregular heartbeat that dramatically increases stroke risk, was simply something she would have to manage with medication for the rest of her life. She had accepted this. She had stopped asking questions. When Patricia came to see me, I asked her about her sleep. She told me she slept on her stomach, face down, arms tucked under her body, head turned to one side. She had slept this way since childhood. I explained to her what stomach sleeping does to cardiovascular function in seniors. When you sleep face down, your entire body weight compresses your chest cavity. Your lungs cannot expand fully. Your diaphragm is restricted. This creates a chronic low oxygen environment during sleep, which forces your heart to beat faster and less efficiently to compensate for the reduced oxygen delivery. In a person with existing atrial fibrillation, this oxygen deficit during sleep is like throwing fuel on a fire. We worked together to transition Patricia from stomach sleeping to left side sleeping over a period of 4 weeks using a combination of pillow positioning and body cushions that made the new position feel natural and comfortable. At her 8-week follow-up, Patricia reported that her AFib episodes, which had been occurring 3 to 4 times per week, had reduced to once in the past month. Her cardiologist confirmed improved heart rhythm consistency on her monitoring data. He reduced her medication dose for the first time in 4 years. Patricia told me, "I spent 74 years sleeping the wrong way, and nobody ever told me. Now I want to give you the exact method for optimizing your sleep position for maximum heart and circulation support. Because simply knowing to sleep on your left side is not enough. The precise positioning of your body matters enormously. Here's exactly what to do tonight. Lie on your left side with your body in a straight but relaxed line. Place a firm pillow between your knees. This keeps your hips aligned and prevents your spine from rotating, which can create pressure on the nerves and blood vessels of your lower back that restricts circulation to your legs overnight. Place a second pillow under your head that keeps your neck in a neutral position, not tilted up or dropped down. Your ear should be directly above your shoulder. If your top arm falls forward and rotates your chest toward the mattress, place a third pillow in front of your chest and rest your top arm on it. This keeps your chest cavity open and your heart in its optimal position throughout the night. This 3-pillow setup costs nothing if you already have pillows in your home, and it transforms the cardiovascular quality of every hour of sleep you get from tonight forward. If you have been a lifelong right side or stomach sleeper, the transition will feel uncomfortable at first. Your body has muscle memory for its habitual position and will want to return to it during the night. This is normal. Use a rolled blanket or firm cushion placed behind your back to prevent unconscious rolling during sleep. Within 2 to 3 weeks, your body will adapt to the new position and it will begin to feel natural. There is one more adjustment that cardiologists consistently recommend for seniors with circulation concerns, and most people have never heard of it. Elevating the head of your bed by 4 to 6 inches, not with extra pillows under your head, but by placing risers under the legs at the head of your bed frame, uses gravity to gently improve venous return from your lower body throughout the night. This slight incline keeps blood flowing efficiently from your legs back to your heart without any effort, reducing overnight swelling and supporting healthy blood pressure regulation during sleep. A study published in the Journal of Clinical Sleep Medicine found that seniors who slept with a 7.5-degree head elevation showed a 26% improvement in overnight circulation markers and reported significantly less morning fatigue and extremity swelling compared to those sleeping completely flat. These adjustments, left side positioning, 3-pillow support, and slight head elevation work together as a complete cardiovascular sleep system. They are completely free, they have no side effects, and they work every single night while you are completely unconscious. Your heart has been working for you every moment of your life without a single second of rest. The least you can do is give it the right conditions to do that work as efficiently as possible while you sleep. Now I want to hear from you. Drop a comment below right now with your age and what position you currently sleep in. I read every single comment and respond with personalized guidance based on your specific situation. Your comment might also help someone else who is reading and recognizes themselves in what you share. And if this video opened your eyes to something that has been affecting your heart every single night without you knowing, please share it with someone you love right now. A spouse, a parent, a friend who complains of swollen ankles or morning fatigue. You might be giving them something their doctor never did. The truth. Your heart deserves better than the wrong sleeping position. Starting tonight, give it exactly what it needs.